we'll get started with introductions. I'm Dr. Betsy Greene, State Equine Extension Specialist or Horse Specialist, whichever, in University of Arizona. I've been here a little over 5 years, and I was in Vermont for 20 years before that. And where else? Washington State for 7 years before that. So I've been here around a long time. And this is actually our first official Informed Arizona Equestrian webinar. And we are so glad that you guys are joining us. And a couple lucky people will actually be put in for a drawing for a couple of Informed Arizona Equestrian mugs, the RTIC or whatever they are, kind of like Yeti mugs, 30 ounces. They're pretty nice. So I should have brought one back in here with me. So tonight we have Danielle Smarsh, who is a friend and colleague, who is the Equine Extension Specialist at Penn State University. We have some of her people on here as well. And she is also an assistant professor. You've been there 3 years, 2 years?
3 years now. Yeah.
Holy moly.
I know.
And so she's going to talk to us about opening up a can of worms, understanding and managing equine parasites. But before she does that, we're just going to do a quick little refresher. And those of you that have been around have seen some of these things before. Webinar etiquette. We are here for a lecture and discussion with Danielle, so we'll kind of keep it on topic and not go off topic and chat. But since it's webinar style, everybody is muted and you don't have a camera. You have two options to communicate with us, through the chat or through the question and answer. So if you're asking a question, it may or may not be answered right away, but that would go in the Q&A. If, for example, Danielle says, who has heard of this wormer, dewormer or something, that would go into the chat so that it's questions that to be addressed would go in the question and answer, others in the chat. Okay, so please be polite and respectful in the chat. Oops. And of course, later, this recording will be available. Does it say it's recording?
Yes.
Okay, perfect. And then, of course, we always just say this, we've never had to do it, we don't want to, but if there is any harassing or inappropriate behavior, the participant will be removed without warning. But now that we got that done, I'm going to stop my share and we will let our wonderful speaker, Danielle, share hers. And we will turn over the floor to you.
Great. Thank you very much, Dr. Greene. I appreciate that. And I'm glad to be here tonight with all of you. While the snow is beautiful, I'm also a little envious of the probably warmer weather in Arizona. Not going to lie. We've had a snowy winter so far. So tonight we're going to think about parasites or worms, as we can call them too, and how we're going to manage them. So we're going to go through a bit and talk about their life cycles, and some things to consider when managing your horses and some tips at the end for this. So it's a lot to cram into 45 minutes. So that there's certainly, if this is a topic you're really interested in, there's some great resources and I'll mention them at the end where you can find some more information to read and watch, because there's a lot to be said. And so this is kind of just skimming the surface. Fair warning, there are some pictures in this set of slides that some might consider gross and not the most pleasing to look at. I have a pretty strong stomach. I teach anatomy and physiology and do dissections and necropsy, so it doesn't bother me, but I know from teaching this subject in the past to students and others that sometimes the pictures can be a little gross in their minds. So just, if you're sitting there eating dinner or whatnot, just be aware we are going to be looking at pictures of parasites and worms. So that this is your fair warning. I wanted to start off with talking a little bit about some basic definitions of what parasites are and what categories we're looking at, because there's a lot out there to think about. And we're only going to really touch on a couple different species tonight, again, just with time constraints and kind of the ones that we see most frequently in the equine world. So a parasite, a basic definition, is an organism that's living either on or in and at the expense of a host. So a host for tonight's situation is going to be the horse, right? And at the expense of mean, you know, they're using it as an environment to shelter in, or they're consuming parts of the animal. And these are small organisms, not necessarily, you know, at certain life stages, they will be microscopic, but at the adult stages, most of these you should be able to see with the naked eye. But they are small. We can further subdivide that category into ecto and endoparasites. So if we look at those prefixes of those words, ecto meaning outside the body. So we'll find these parasites, you know, on the skin, around the mouth, around the anus. Think about these two diagrams up here on the top right, the tick and the mosquito. We think of those as ectoparasites. First, an endoparasite would be one that's found inside of the animal. So we've got some pictures down here of some of our different worms we'll be discussing tonight that are considered our endoparasites. You can also think about these parasites as if they are specific or non-specific to the horse. So again, you know, I kind of group these pictures. The top two are black-legged tick and this mosquito here are considered non-specific to the horse, right? So they're going to come after not just the horse, but you, your cat or dog, other livestock. So they're going to use a variety of different species as a host, versus those that are specific to the horse. So many of the parasites we'll talk about tonight are going to focus on the horse as their only host that they're going to have. So for example, we'll talk about the strongyles. And while you can find strongyles in a variety of mammals, you know, so there's a set that use us as a host or other livestock, the ones that are used specifically or against horses, that's their target. That's the one they're going to use. And so we want to keep that in mind for the future as we talk about management strategies, knowing that each, again, within livestock are going to have their main set of parasites that only attack them. And then finally, these parasites we're going to be looking at tonight, they're pretty clever. They've come up with a lot of sneaky ways to evade us and our management strategies. They've evolved over time to come up with the best survival tactics. These parasites, many of them have been around for a very, very, very long time. And so we need to understand these evolutionary adaptations as we try to figure out how to manage them and control them, and go from there. I also want to bring up just the basic life cycle, because we'll be seeing a lot of the pictures that we see here on the right-hand side, this circle structure. We're going to use that quite a bit to look at our different parasites. And so there's key stages that all parasites are going to go through. So they're going to start off as eggs, right? And then they're going to grow up to be larvae, and you'll often see the different stages of larvae listed here, such as L1, L2, L3. Now, that doesn't mean there's only 3 larval stages. It kind of depends on the specific species. So some might have 2 larval stages, some have 5. That gets more species specific, but they all have some sort of larval phase to their life. And then from the larval phase, they're going to go ahead and become our adults or our full-grown worms. And even then, you can subcategorize into the immature versus mature. And the difference being mainly, are they reproducing or not? Some other terms to think about here, you know, as we look at this just generic life cycle here on the right-hand side, is that there are going to be stages where the parasite is in the horse, right? And there's going to be stages where they're outside the horse. So the stages outside are considered free living. And the free living stages where we can do a lot of management strategies that involve the environment of the horse and where the horse is housed. There versus the stages within the horse, this is where we're pretty much limited thinking about our dewormers and how we can use those products. Another stage to think about is the infective or the parasitic stage. And this is the stage generally where the parasite is going to be ingested by the horse and then have the opportunity to become an adult. So once we've reached an infective stage, that parasite has the opportunity to mature and become a reproducing adult worm. Finally, we need to also consider a phrase or a term called the intermediate host. So while we are focusing on the horse as the main host for the night, there are a couple worms that need to have a second host in this life cycle here. So you'll see it, again, we're going to use lots of diagrams tonight. You'll see that host pop up along there as well. So these intermediate hosts are going to be utilized again as part of the life cycle, and they're vital for the parasite to survive It needs to have both the horse and this other host in between. Okay. So again, lots of kind of potentially gross pictures for you here of some of our key players we'll be talking about tonight. There's a long list of parasites that are out there that you might be concerned of for your horse. So I give a condensed list here from the strongyles, the ascarids, tapeworms, bots, pinworms, threadworms. There's many more that we could list on here. And again, just mainly due to not wanting to completely overwhelm the audience tonight with information and the fact that we don't have a lot of time, I'm not going to get into every single one of them. I'm going to focus tonight on strongyles mainly, and we'll talk about a couple others, as well as tapeworms, because they're probably some of the parasites that we see of concern the most in adult horses. And I stress adult horses because if we were talking about foals and weanlings, we'd probably have different, not in addition to the ones listed here, additional parasites to consider and different strategies for how to manage them in our young horses. So when I say young horse here, I'm talking less than a year old. The American Association of Equine Practitioners, the AAEP, has a great set of guidelines on their website that I'll refer to several times throughout the talk and again at the end as a reference. I would encourage you, they have nice discussions there of what to do for young horses versus adult horses. So we need to consider that as well. But again, tonight, the major parasites we're going to be talking about are those strongyles and tapeworms. And so that's what we're going to be focusing on tonight. I'm just checking the chat. All right, so we're going to go through each of these parasites. Again, focusing mainly on the first half of this list here, and we're going to look at their life cycles, thinking about the different stages, think about where in the environment we find these different parasites, and then some kind of key facts, interesting things, unique aspects of each one of these different parasites. Before we get too far into the parasites, I did want to remind all of us about the GI tract anatomy of the horse, because most of the parasites we're going to talk about tonight, well, all of them at some point are going to spend time within the GI tract of the horse, right? Because consumption through grazing is the way that many of these parasites end up inside the horse. So yeah, I like this picture on the left of the horse just to kind of show you where the organs of the GI tract are within the living horse, right? So we start with this small stomach, then we've just got all the intestine kind of bunched together, and here's all that large intestine on the bottom. But if we took the GI tract out and spread it out, you'll get the picture here on the right-hand side. So again, you know, we've got the stomach here on the far right, and then this thin tubing here is the small intestine. And then we've got, if we got this blind pouch here, that's the cecum. These two large extended, you know, a larger diameter sets, that's the large intestine. And then we finally finish out going out through the rectum and the anus. So we're going to think of tonight about the stomach, because we're going to have some parasites that are going to be in the stomach. The small intestine here, some parasites like the small intestine. Some are going to like the cecum and the large intestine. And also remember too, we talk about the horse being a hindgut fermenter, right? So the hindgut of the horse starts with the cecum and the large intestine. So again, stomach, the small intestine, and the large intestine or the hindgut are going to be the kind of three key areas to think about for these parasites. And I also want to point out where we're looking, if you look at these diagrams, you see all these small red lines here. You know, we've got this very thin membrane called the mesenteric, kind of keeping all the gut together. It's like saran wrap. And it's got within that saran wrap, all the blood vessels as well. So if we think about all these little red lines here, so providing blood to the gut. So we're going to start with small strongyles. Of the parasites we're talking about tonight, these are the ones that you're going to come across the most often. And I'm curious, you know, if you want to type in the chat, those of you that have seen small strongyles in a fecal egg count, or you know that your horse have had them in the past. So if you've seen strongyles before from a horse that you either own or care for in a fecal egg count, you know, let me know if you have or have not. But they're definitely the ones I see the most frequently in our fecal egg counts. And they're not necessarily fatal to the horse or anything like that. In most situations, they're going to be around. And what we'll talk about a lot through this evening is that we're never going to get rid of all these parasites. It's impossible. It might disturb you, but there are parasites inside you and I right now. There's parasites inside of your pets, your dogs, your cats, and the horses. So we're never going to get rid of all of them, but we want to control them. So small strongyles, we see them pretty frequently, again, in our adult horses. And their life cycle we see here in this circle on the left on your screen. So again, we start with the eggs. It's kind of the most immature, smallest phase of these parasites. The small strongyles are going to go through several larval phases. The first 3 are going to be on the grass. And it's the L3 larvae that are the infective larvae that are what the horse is going to ingest. And these L3 larvae, they're pretty sneaky. And one of their cool things they can do is that they are able to actually crawl up blades of grass to the very top to ensure that they are most likely to be eaten by a horse. Now, horses are notoriously hard on pastures. They're well known for grazing pretty low to the ground, as if you have a lawnmower out there. But still, these small strongyles, they're going to climb up the blades of grass so they can reach the top to be ingested by the horse. Once the L3 larvae enter the horse's GI tract, they're going to go ahead and migrate down to right about where the small intestine ends and the large intestine begins, and they're going to hang out there. And that's where they can mature into these L4 larvae. And what their other neat trick, besides being able to crawl up blades of grass, is that they can do something called insestment. So you see this word insist at the top of the slide here. Basically, that means they're going to burrow into the walls of the GI tract and hang out there. They make a nice cozy little home, and they can stay there for at least 2 years. If you talk to scientists that really study this, they say minimum 2 years. We're not sure how long really they can stay in there. It could be for longer. And they're going to hang out in the wall of that gut until they have a good opportunity in the environment of the horse's GI tract to re-emerge. So parasites are, they are going to need nutrients and have space to grow. And so they're going to kind of use this insestment as a way to manage the best opportunity for when there's room available and nutrients available for them to grow up into mature adults. Are there questions, Betsy?
So yeah, did you see that in the chat? What if you're on a dry lot, which in Arizona, we have a lot of dry lots, a lot of sand, and they're only eating hay? Can they pick up worms from that situation?
Potentially, yes. So the thing about these strongyles is that they can survive potentially for years in the environment, even if you've had, depends how long you've had that property. But they could, if that dry lot was formerly pasture, there could be some strongyles in that ground. And if there's hay on the ground, they might be able to crawl into that. Now, your odds are certainly reduced if they're in a dry lot compared to a pasture, but I won't say you're totally 100% clear in that sort of situation.
Well, and in our symposium the past weekend or weekend or so ago, one of the veterinarians that was presenting talked about having a situation where they had found tapeworms had been transported in hay, and I believe it was baled hay. So that question that's in the question and answer, yeah, that our vets had said that.
Yeah, I mean, again, these guys are hard. They're hard to get. You're not going to get rid of them. So yeah, again, your odds are much lower with the dry lot situation, but there's still that risk to pick it up. So again, their evolution's all about survival. They've done this for thousands and thousands of years and will continue on probably well beyond all of us here, right? So they can crawl up blades of grass or blades of forage, right? They can, within the horse, burrow into the walls of the GI tract for at least 2 years until they have a good opportunity to rupture out and then fully mature. Small strongyles also, as we talk about the environment, they can withstand pretty big extremes in temperature, especially again, the L3 larvae. They're kind of the superheroes of this life cycle. So it can get below freezing and they can do okay. We can get up to 100+ degrees You know, once they get past 110 degrees Fahrenheit, that's going to be tough for them. So again, you guys down in Arizona, if you get a stretch of days like that, it's probably going to kill off a number of them, but they're never fully gone from the environment. So I want to talk briefly more about this insisting stage because it can lead to something called Cyathostome Miasis. So this word comes from the fact that small strongyles are also known as cyathostomes. And what can happen, this potential problem, is that you have a large number of them erupt all at the same time. And so we've got a picture here. Now, small strongyles, there's a lot of different species that impact horses. Again, there's probably close to 40 different types of small strongyles that can infect the horses, but some of them are small and red. So they're also sometimes called bloodworms, if you've heard that term before. And so the problem with this Cyathostome Miasis is that if you get a large amount all of a sudden in the gut of the horse, this could potentially lead to colic and issues like that. There could be some tearing of that hindgut membrane. So we sometimes see it either after a deworming or sometimes as the seasons change. Now you guys are you're a bit backwards for me from in terms of the parasites, because we see them obviously during our summer down in the Southwest, right? It's more opportune for your parasites during the winter season because the temperatures will be a little bit cooler. So we both need to remember here about inverting when the parasites will appear for us in the different areas of the country. So beyond that potential large number of small strongyles appearing at once, again, they're not necessarily deadly to your horse if they're managed properly. They're hard to get rid of. And again, you know, found on pasture and or in the environment. I do want to mention here briefly large strongyles, because that is the other category. And there's fewer of them in the horse. There's only 3 main species here. Today, this day and age in 2021, large strongyles really aren't a big concern. There's not, to our knowledge, a lot of them still left out there. 30, 40, 50 years ago, they were the #1 parasite. So when you look at reference papers from the 60s and the 70s and the 80s, it was the large strongyles that were really prevalent everywhere. With that being said, there's still some out there. We still see some pockets of horse populations where we can find large strongyles. And this one in particular, this vulgaris species, is considered by many to be the most pathogenic nematode of horses. So nematodes were in a class of worms that includes the strongyles, the roundworms, pinworms. Those are all nematodes. Pathogenic, most likely to cause disease. So the reason why those vulgaris large strongyles are a problem, they like to travel. So we got this little travel symbol over our horse here. They like to go explore the regions of the horse. So again, normally the parasites are being eaten by the horse and they travel through the gut. A couple of them like to kind of veer off and take an exploratory trip around the body. And so these large strongyles, they like to go migrate through the blood vessels. And in particular, they like to go and end up at what we call the cranial mesenteric artery. So if you remember, I mentioned the mesentery of the gut. So this is one of those very important blood vessels that supplies blood to the GI tract. And so these strongyles, they can, if you look at this picture on the bottom, can create blood clots and some lesions. It's thought to potentially lead to lowered blood flow to the gut, which we know in a horse is bad because that again leads to issues with colic, with parts of the gut dying off. So I bring it up because it does occasionally happen. You'll find the vet that talks about the case they had, but it's rare. So there's small pockets of this group out there, but this was bigger issue 30, 40 years ago. And the large strongyles, they follow the same life cycle as the small. So it's a similar path as what we saw on the other slide. Now, tapeworms, our next parasite here. So that's the other one you're probably going to see occasionally and can be a potential issue as well. So the life cycle, if you look at this diagram here, again, starting with the eggs in the feces and manure, they're going to go down and we're going to have the eggs in the pasture. We are going to have an intermediate host in this cycle where we've got the mite. So if you can kind of see this picture here, this is the mite. The mite will eat the tapeworm eggs, and then the horse will eat the mite. This is like that old childhood story, the old lady that swallowed a fly, that whole debacle. That's basically what happens here, right? The horse eats the mite and the mite has eaten the tapeworm. inside the horse's GI tract, the mite is digested, and then the tapeworm kind of emerges, and it's going to, the larvae then mature into the adult. And they're going to look like, I've got two pictures here, this on the left and then this one on the right. They're not the biggest of the worms here. I mean, they're maybe the size of your thumb, the ones I've seen in necropsies. So they're not terribly large in the horse. Again, the problem becomes when there's a lot of them together in one area. They like to hang out at what's called the Ileocecal Junction. And so that is the junction between the ileum and the cecum. The ileum is the last part of the small intestine of the horse, and the cecum is the first part of the hindgut. And that junction, it's very small. It's a very, again, we saw the small intestine in the diagram. It's a very narrow tube that's joining then to a larger structure being the cecum. And so that's just, and we've all been on highways and other things. You merge from 3 lanes to 2 down to 1. It's kind of one of those situations, right? So we've only got one little lane here. And so we can occasionally have cases of colic that have been attributed to these tapeworms appearing at the ileocecal junction in high quantities. This is another one of those parasites that's found on pastures. So again, if you've got horses out on pastures, they kind of seem to be around pretty consistently out there. I should also note with these life cycles, for this one, for tapeworm, they don't have kind of a pause like the small strongyles do, but most of these life cycles are going to take from 3 to 6 months to go through. So you think within a grazing season, basically, they can get through a lot of these. The one thing to note with tapeworms is that there have been some studies done that look at the prevalence across the United States. And certainly there's also some studies looking at worldwide, but I figured for tonight, I sort of guessed most of our audience was within the US, so we're going to focus on that. And so this was from a study from maybe, I think that's about 15 years ago. So I don't know, I haven't found an updated map yet, unfortunately. So we'll make do with this data, but they found that in certain regions of the country, you're more likely to see tapeworms. So, you know, I'm up here in Pennsylvania. I know we've got a couple other Northeast people up on this call. We know that prevalence is about 63%. For those of you down in the Arizona Southwest region, much lower prevalence of tapeworms. So, you know, again, we're going to talk about fecal egg counts later on. It's rare for me to see the eggs of a tapeworm in there. I see them every once in a while, not as often as the strongyle. Again, I've done probably several dozen necropsies in my time, and I see the tapeworms a couple times there. So again, they're usually not a huge deadly problem for your horse, but just to be aware that they're out there. So those are our tapeworms. Ascarids. So I told you the focus of this tonight would be on adult horses, but I did want to mention ascarids because it comes up a lot when talking about parasites. And we do every once in a while see them in adult horses. So ascarids, known as roundworms, generally thought of as a problem for young horses. And again, young being less than a year old. Generally young horses, we see them really susceptible by, you know, peaking around 4 to 5 months old, and it slowly tapers down. And the ascarid life cycle, if we look at it here on the left, again, you guys have probably seen the same thing over and over again. There's eggs in the manure and the pasture. We get eggs going through on that pasture, different stages. The eggs will be ingested by the horse, and then they're going to migrate through the body. Now, the ascarids are kind of like the large strongyles. They're the travelers of the horse. They don't want to stick to just the GI tract. They like to go take a tour around. So these ascarids will go to the small intestine, and then they'll take a detour and migrate through the blood vessels to go over to the liver, where they can cause some damage there. Then they're going to migrate from the liver, hop back into the bloodstream, go over to the lungs, create some damage there. They'll actually, the young horses will cough up the ascarids and then swallow them. So now the worm is going back through the GI tract, and at that point, then they will mature into adults where they can then lay eggs. So some of the symptoms that we see with these foals do relate to the GI tract. So coughs and nasal discharge. Now, anyone that's been in a barn, especially with a bunch of young foals, know you're often going to find these symptoms for a variety of reasons, not just because of ascarids. So it can take some sleuthing to figure out what is causing the coughs and nasal discharge. Is it a virus? Is it a parasite? What's going on? Again, not generally going to be a life-threatening situation, but it can just cause, you know, your foal to maybe not be putting on weight or growing quite as well. Ascarids, they are longer. They're probably one of the larger ones. So here's a nice mess of them here. You know, they can be was telling Dr. Greene before this, I think of a lot of pasta analogies, so I apologize again, but these are like spaghetti length ones, maybe a little thicker, that we can find there. The sneaky thing about ascarids, similar to our small strongyles, they are quite hardy in the environment. The eggs can really survive a lot of different extremes in the environment. Again, they can be found in the dirt years later, still viable. And the unique thing about ascarids compared to any of the other parasites we'll talk about tonight is that it's not just pastures where we find them. So these eggs have a sticky outer coating, so sticky that they'll just stick to anything. So not just pasture, but they're found on stalls. They can stick to vertical surfaces, so the walls of the stalls, fences. They've been found on buckets. They even have found them stuck to the udder of the mare that the foal is nursing off of. So they are just everywhere. So something to think about if you do have foals or young horses that you work with, you know, you're going to have ascarids. So again, I'm not going to get into too much of thinking about how to manage young horses with dewormers and whatnot, because it's a kind of a different ball game. But we have to know and realize the fact that ascarids are the main parasite of concern for our young horses. Last parasite here that I'm going to mention again, there was a whole long list I said we could look at, and we just don't have time. So this is the last one I want to touch on, because again, it's one I see frequently, are bot flies. So again, they're seen frequently, but they don't really cause any problems besides just annoyance to the horse, really. So what happens with these eggs, they have a slightly different life cycle because we're dealing with flies. So the mature adult parasite is not going to be found inside the horse like it was for the last several parasites. It's outside the horse. But we're going to have the eggs now laid actually on the forelimbs of the horse, generally the distal part. So when we say distal, we're meaning the lower limb from the knee down. Occasionally the eggs are laid along the neck or the mane, but they seem to prefer the lower limb. The horse is going to graze, right? And then it's going to groom, and it's going to clean itself, and it's going to pick up those eggs when they groom themselves. And those eggs are going to hatch upon contact with the horse's lips. So that's kind of a cool trick there. They only hatch once they've been stimulated. And then they're going to spend some time causing trouble in the horse's mouth and leading to potentially some inflammation and other concerns before they get swallowed by the horse. And then we get the larvae ending up on the lining of the stomach. And they stick on pretty well. Again, when I've done necropsies, I mean, you've really got to kind of pull those little bots off. This is a pretty extreme picture here of the stomach bots on the stomach lining. I typically see a couple to maybe a dozen tops. Again, no real huge concerns here in terms of things like colic, like the strongyles or you know, the tapeworms. Yes, it could potentially maybe be taking up a little space of the stomach lining, but it's not creating damage like ulcers would. So again, the biggest annoyance seems to be, you know, just general fly annoyance like we have for any number of flies that we deal with on our horse farms. So those are the main species we're going to cover. So I'm just going to kind of jump over and see the Q&A at this moment to see if there's anything focused specifically on what we just covered. So I see students asking about deworming, to never deworm. So we'll talk about deworming and the strategy there. So I'm going to hold off on that one. Why have some parasites become more prevalent in recent years than other? A couple of reasons there. I think some might be with some of our resistance. Some might be due to climate change and the changing environments with that one. And so we're going to hit on some of the things you guys are asking. So I like that you're previewing what we're going to get to. I don't know, Betsy, if you want to jump into anything or if we're.
Yeah, somebody had asked about itchy tails, and I typed in something about pinworms being a high potential for that. Whether you go in and out and lay eggs and cause very itchy anus.
Yeah, pinworms they just lost, you know, the cutoff point here as I was trying to figure out how many parasites to put in here. It was between stomach bots and pinworms, and bots won and pinworms lost. But yes, if you've got scratchy butts, pinworms are notorious. Their eggs are laid around the anus of the horse. And so that's why you see the horse kind of scratching up against a stall or a fence. So that's usually, if it is because of a parasite that your horse is scratching, that would be the one to cause the problem there. So that's
Yeah.
a good question.
And there was a comment in the chat saying we've been told we don't have bots in Arizona. We do have them, maybe just not as prevalent as back east where there's a lot more moisture.
Yeah, for sure. Exactly. Good questions and comments. Keep them coming. So moving on to thinking about some guidelines here as we think about managing our parasites on our horses and what to consider. This is kind of a golden rule here that I like my students, adults and undergrad, to know, is that 80% of the eggs are coming from 20% of the horses on the farm. So the 80-20 rule, 80% of the eggs come from 20% of the horses. We know historically our deworming practices were maybe not the best in retrospect, right? We were deworming 5 to 6 times per year, everyone in the barn blindly. That's what vets told us. That's what we were told. That's just what we didn't know enough about the life cycles before then. It's no one's fault. We just didn't have enough information. We do now. And we know that that's probably not the best strategy for trying to manage parasites because of the different things listed on this slide. So the 80-20 rule is one reason. Immunity varies from horse to horse, just like with person to person, right? I mean, we're right now in the middle of a pandemic, so there's been lots of talk about immunity in the news, more so than there has ever been that I recall. So we know everyone has different levels of immunity against different diseases. So the same applies to horses with parasites. Some seem far more susceptible to high case loads of parasites. Some just don't have any or very few. We don't quite know yet. There is research going on, but we don't know why that happens. I'm sure there's some genetic component, but we just find from horse to horse, they're different. We know the age of the horse plays a role. So we know that, for example, ascarids seem to be, adults seem to be fairly immune to ascarids. Again, you might occasionally find ascarids in an adult horse, especially if you have young foals and you have a breeding farm, that's more likely. But the vast majority of horses, by the time they're 2 years old, are pretty much immune to ascarids. You're not going to find them. That's probably the only parasite where that really happens. But even so, the age of the horse can also impact, what level of immunity that the horse has. So for example, we'll talk about horses being high or low or moderate shedders. So a horse that is considered a high shedder probably has lower immunity to parasites because we're going to see lots of eggs being shed in their manure. We know once a horse hits about 4 to 5 years old that as long as they stay healthy and they don't undergo extreme stress or extreme illnesses, that their shedding count is going to stay the same. So if they're a moderate shedder at age 7, if they're still healthy and doing well at age 15, they're still going to be a moderate shedder. We're looking into seeing past age 20, 25 if that changes. Jury's kind of out on that, but for their bulk of their adult, years from 5 to 20, they're going to have the same level of shedding. Again, we're not sure why some individuals are high versus low shedders. That's just how it goes. We need to consider the environment. So again, it's kind of a great setup that we've got, again, this kind of northeast versus southwest going on in this webinar, because we've got very different climates. We've got different things to think about in terms of the humidity level of the air, what seasons our parasites up in the Northeast are going to thrive during our summer. Yours are going to thrive more during your winter. So that's going to come into play. And so all this is going to really be things to consider when you think about deworming, right? And how often you're going to deworm your horse. I wouldn't say there's any horse that should never be dewormed, but there are certainly many that could go by with just 1 or 2 dewormings a year, versus some of our high shedders that still will need that 4 to 6 times a year. So that's where you talking with your veterinarian is going to be really important, right? To kind of figure that out. So we know now, we've had so much more research on parasites in horses that there's a lot that comes into play. We can't just do a blanket rule of 6 times a year for every horse in a barn. That's not going to work. You probably need to do 4 to 6 times a year for maybe 1 or 2, depending on how many horses you have, right? If you've got 10 horses, maybe only 1 or 2 of them need that high level. Most of them will not need that. So another kind of common thing we were told, for many years was to rotate your dewormers, right? Go between one product to another, and we should be good. The reality is, while there are tons of products out there, if you read the tiny little print underneath many of these brand names, and this is just a total random selection here of dewormers I've selected, but if you read the fine print for many of these, you come upon what we call the drug class that it is. And lo and behold, there are really only 3 major classes of dewormers out there. So we've got the benzimidazoles, the pyrimidines, and the microcyclic lactones. Those are really the bulk of the products out there in the market today are going to be one of those 3. Okay. So that's not necessarily the greatest news as we continue through, as we think about resistance, but that's what we have. And the different drug classes, to some extent, are going to target slightly different parasites. You know, these top 3 are going to have some overlap. They're going to differ a little bit in their mode of attack on parasites. So generally, they're either going to try to paralyze our parasites, so that way they can't latch on or move around, they just get passed through the gut, or they're going to impact the metabolism of the parasite, so they basically end up being starved, and again, killing them that way. The different drug classes, you might be more familiar with some of the subcategories. So within each of these 3 major ones, you get some subcategories. For example, the most common ones you'll probably know are ivermectin and moxidectin. Those are both macrocyclic lactones. Fenbendazole, if you've heard of that, is actually a benzimidazole. Okay. So again, even if you've got several different names underneath them, again, for example, ivermectin and moxidectin, they're still both considered macrocyclic lactones. And they're going to have similar mode of action against parasites. There are 2 minor classes down here listed. The praziquantel only works against tapeworms, and you'll often see praziquantel combined with a macrocyclic lactone to that way target the tapeworms plus the strongyles and the other ones. So again, many of these major drug classes up at top, especially the benzimidazoles and macrocyclic lactones, aren't necessarily going to work against tapeworms, so they'll add the praziquantel in to help. The piperazines, this was something that was used, again, historically 30, 40 years ago as one of the first dewormers, but you needed a large dose, so large that you needed a nasogastric tube, and that's not really convenient for many of us. You know, we are able to give deworming medication here in the United States ourselves to our horses. We don't need a veterinarian. Nasogastric tubing is a bit more complicated than simply, although depending on your horse, maybe it's going to be a similar level of difficulty. We've all, I'm sure, had that horse that's not the biggest fan of being dewormed, right? But regardless, the piperazines they're not on the market anymore. So again, the major classes of dewormers, those 3 at the top, and then the praziquantel for our tapeworms. So resistance is the ability of the worms to survive the treatments. And that's what we're dealing with now that we're realizing is the problem. We know resistance, it's these parasites through every subsequent generation. They are inheriting genes that allow them to survive the deworming treatments. It does occur over time, but the rates are going to vary based on the specific parasite and what product is being used against them. But no matter what, we're going to eventually see a point where the dewormer is no longer going to work. We can use a couple different tests. So the FACRT is the Fecal Egg Count Reduction Test, and ERP stands for Egg Reappearance Period. These are 2 ways that we can see if resistance is occurring to different products. So I have a table in here from the AAP that's showing the 3 major drug classes and where we see resistance. And you'll note that the benzimidazoles, small strongyles, are widely resistant to it, versus the ascarids, they still mostly work. There's some early indications here and there, but they, for the main part, work. Versus by the time you get down to the macrocyclic lactones, it's kind of a different situation where it still works fairly well against strongyles, but the ascarids are pretty resistant to it. Now, I will note that when we delve deeper into research, there's certain, you need to look at on a farm by farm situation, because sometimes certain farms, especially if they, are fairly isolated, they might still, some of these drugs might work still fairly well for them. When you get to large boarding farms and horses are coming and going all the time, that's going to be a problem as well. But we're seeing this trend for these 3 different drug classes. This is why refugia are going to be really important for us. So this is going to be the population of parasites not exposed to dewormers. So this is, again, those horses that only dewormed once a year are going to have a lot more refugia that we want, because we want them to mix with parasites from our horses that are being dewormed more regularly to try and dilute down the resistance. Again, it's inherited genes. So if you get the refugia out in the pasture with your horses that have that are high shedders, they can hopefully, those parasites can mingle, and we can kind of, again, dilute down the level of resistance happening. And there's plenty of studies out there. We know resistance is happening. So there's plenty of papers I could pick to show you, but I just picked one from 2015 by Martin Nielsen, who's a well-known parasitologist at Kentucky. And they did a giant survey around the United States to see how well dewormers are working against strongyles. So efficacy is how well a drug is working. And they found, again, they looked at the lactones, the pyrimidines, and the bendamizidals, and they found that, just as we said on the table, the lactones were most effective versus the benzimidazoles were the least effective. So we've got this data out there. You can find that, it's not just the US, we're seeing this worldwide as well. So we're in a tight spot here. We only have 3 drug classes, and frankly, we haven't had a new drug developed for horse dewormers in decades. It's not a high priority, honestly. It takes time and money. Again, the pandemic's been a perfect example of this. When you have resources and lots and lots of scientists working on a problem, they can solve it quite quickly. But if the funds and the people aren't there, it just takes forever. The drugs we do have, again, only 3 classes, and they mainly work by either paralyzing or starving the parasites. And again, while a growing number of people are acknowledging that we need to do targeted treatments, there's still just as many out there that still do routine, the 6 times a year for every single horse in the barn, or we're not dosing the correct amount, right? All those dewormers have certain, weights you're supposed to give the drug at, and you need to make sure you're giving it at the right amount for it to be most effective. So it's just like with antibiotic resistance, the same problems happening with these anthelmintics as well. So it's becoming a pretty big concern here. So the goal, again, we're never going to get rid of all the parasites. That's not a thing, and that's not going to work. But we want to make sure we have a reasonable level of parasites and keep resistance low. Okay. Again, the problems that these parasites can cause are when we get large numbers causing things like colic and impactions. We want to make sure we keep low numbers down and make sure that we keep resistance as low as possible. So is anyone here? You can let me know in the chat, who here has had a fecal egg count done for their horse? Either personally, you've done it yourself. If we were in person, I would have we would do this, or, either had your vet run it, or there's a couple private companies that you can send your samples to. There's options out there now for you to get fecal egg counts done. So if you haven't done it, definitely you should be doing them. I see a couple of you are saying every year, and that's perfect. That's what minimum you should be doing. They are pretty easy to do yourself. Really, the main equipment you need is a microscope, which you need a pretty simple one, which you could even probably find used from a school even. And then they get little slides for that as well. It takes all of 10 minutes to do, really. And then you count the eggs and you find out how many eggs per gram your horse has. And so that fecal egg count reduction test I was talking about, this is the equation they use to find that. So they'll do a fecal egg count and find the eggs per gram before you treat the horse, do another one 14 days after and find the % effectiveness. And so again, the ones that are very effective are going to you should have a high drop in eggs from 14 days versus the ones that are not very effective. You're still going to have pretty high numbers at that point. And again, you're looking for in the microscope the eggs, so not the adults, not the larvae, the eggs. And so, you look for those strongyles. They're going to be the ovals here, right? The tapeworms have this classic D shape that we can see right here. And then the ascarids are well known for having this brown, clear circle. So again, it takes some practice. It can be done. I have undergrads that learn how to do it, right? 4-Hers learn how to do it. So again, whether you get it sent out and your vet does it, or again, if there's a bunch of you at a barn that will say, hey, let's go in and get a microscope and a couple slides. And then the equipment's very cheap and easy to maintain. But that's what they're going to look like. So just to kind of wrap this all up, and then we can talk with some questions, because I see chat and Q&A kind of are popping up here. There's lots of ways beyond the dewormers to manage parasites on your farm. And this is what we encourage, are you doing all these things listed here in addition to dewormers? If you're only using dewormers as your strategy for parasites, you're missing a large part of the puzzle here. And we're only speeding up resistance. So there's a lot to be done with the pasture. That makes sense because we've got a lot of these parasites out on pastures. And whether it's pasture or even dry lots, whatever it might be, manure is key, right? Almost all of these that we talked about tonight, they're being moved through manure. So removing manure from the field, from the dry lot, from the round pen, wherever the animal is being housed can help. Obviously, that's not necessarily practical in many situations, especially if you've got a lot of land. You also need to think about stocking density, right? We know you should probably have, I mean, they suggest 1 to 2 acres a horse. But the real way you can tell stocking density, especially if you've got pasture, horses don't graze evenly. So there'll be the roughs, we've got the tall grass, and then the lawns, the short grass. And the roughs, they're going to generally also where they're defecating, and we have the manure. And the horses don't want to eat near that. But if there's a high stocking density, they'll be forced to, and they're more likely to pick up parasites in that capacity. So we need to think about stocking density and what the odds are the horse is going to be grazing closer and closer to manure and more likely to pick up parasites. Hay feeders can help in that situation. We were just talking earlier about getting parasites in hay, but if you're keeping the hay up off the ground, you're keeping it away from the manure, and hopefully reducing that risk of having contamination. Pasture rotation and spreading, I've got question marks because it really depends on the situation if they help or not with managing parasites. Again, you really need to, for pasture, we talk a lot about pasture rotation in terms of keeping your grasses healthy, and the rotations can be anywhere from 1 week to a few weeks. But if you want to rotate for parasites' sake, if you want to try to reduce the level of parasites your horse is exposed to, you need to have them on the field and then take them off for a year. And that's not feasible for many of us. As much as we love the giant horse farm with lots of pastures, that's not the reality. So that can be tricky. You could rotate if you have other species. So again, many of the parasites that horses have, they're not the same ones in your sheep or your cattle. So that way that you're utilizing, maybe if you've got 2 fields, that can help a little bit. So you're swapping fields and it's different parasites. So that could be an option. But the pasture rotation, they've got to be off it for months and months if it's really going to make a difference. So we can get through some cycling of seasons. Spreading manure on a field, again, it depends on the weather. The max temperature for these parasites, most of them is about 110 degrees Fahrenheit. Up until that point, they can continue to grow and become larvae and become infective. The low is, about freezing level. So that's a pretty wide range of when they're active. So if you're spreading your field and it's still 50 degrees out, or it's still 95 degrees out, they might not necessarily die as much as you would like to. If you're able to break up the manure balls, that does help, because that manure ball is like the perfect little environment for them. So if you can break that up and it dries out. So again, maybe in Arizona, you guys are going to have better luck getting a bunch of hot, dry days above 100 degrees, I'm assuming, right? In the summer. We can't necessarily Northeast guarantee that. And similarly in the winter, while it can, this weekend we were supposed to get down into the single digits here at night. But if you've got snow covering the ground like we currently do, that can help to insulate the ground. So there's a lot. We know the weather, we can't predict it. It's so tricky. So there's a lot to think about for spreading and what that's going to do to actually kill the parasites or just spread them everywhere. So dry lots, again, as we talked about, they can be helpful because it is going to lower that risk, as we were discussing before. So that could be an option. Composting is great for a variety of means, including parasites. Composting will get well above that 110 degrees Fahrenheit, and in a few days can kill most ascarid and strongyles eggs, just about. So that's a great way to kill the parasites, and you've got this great nutrient-rich material that you could use in gardens or back out on your pastures. And then finally, deworming, it's not recommended to never deworm your horse. So you just need to think about the time of year and the seasons, right? So these ones that they're more likely to pick up on pasture, depending where we are in the country, you're going to be looking at deworming in the spring or the fall, not in the middle of winter, right? Not necessarily in the middle of the summer. You need to be doing these fecal egg counts to see what type of eggs you're dealing with. Do you have only strongyles? Do you have strongyles and some tapeworms? Do you even have an ascarid mix in? Thinking about the drug class that's going to be most effective against them. Again, the shedding categories for your horses, the low, medium, and high. If you've got a low shedder, they probably only need to be dewormed once or twice a year versus a high shedder 4 to 6 times a year. So that medium category, people always ask about the middle category, 200 to 500. That's kind of a personal call with your veterinarian of what to do in that range. Where do you pick that? That's more up a kind of gray area, but it's pretty clear the low and high to deworm or not deworm at that point. So overall, take home message here, horses will always have parasites. You're not going to get rid of all of them. That's not the goal of management, to totally eradicate them. The goal is to keep them at a manageable level. We know parasite management is an individual approach, thinking about every horse in terms of high, low, moderate shedders, what their health status is, and then also thinking about where that individual is housed, how often they're traveling. So a lot to think about there. And of course, again, always, work with your veterinarian to produce a good plan for your horse or horses, because they can have a good sense of your horse's health program, and what products would work best for them. And again, they're a great means for getting those fecal egg counts done, if you don't have the equipment to do so. Sources for you beyond this short 45-minute talk here, the AEP Parasite Control Guidelines. If you simply Google that term, it's about 20 pages, but it's not too hard to read. It's free. So it's a nice written outline of what to do. Our extension site on Penn State, we actually have an online course that you can take that's far more detailed than this. So if you want to get more into it, you could sign up for it there. And then again, your veterinarian, your veterinarian's a member of the AEP, so they'll have up-to-date information as well. So with that, I'm going to stop here. We can kind of check on the chat in the Q&A box, see what you guys have been talking about. I thank you for your time this evening, and I appreciate seeing all of you tonight.
Okay, so I just, first of all, thank you very much, Dr. Smarsh. And we've got some comments and questions. Some of them overlap a little bit, but I will tell you, I just put that link for the guidelines for parasite control from the AAEP.org in the chat. So you can click on that and then have it open for another after you're out of this. So there was a couple of comments, the best optimal time to deworm in Arizona, but at the same time in the chat, does the amount of egg shedding determine the amount of times and perhaps timing to deworm throughout the year? So I think you kind of got
yeah, so generally it's the transition. So transition of seasons, right? So, again, in the Northeast, we're looking at maybe the fall for us, right? The horse has been out on pasture now, they've been accumulating parasites. The flip would be, reverse would be true for you guys, right? Coming, I guess, from spring into summer, right? So we're looking at spring, summer, those two seasons, looking at which time of year, again, depending where you are. And yeah, again, we've talked about, if you do have a horse that is a high shedder, you will need to be deworming more regularly. So if you are spreading out, you will be ending up in those other seasons as well, right? But for those low shedders, and specifically, a spring and fall, that you could look at those two situations for deworming times.
So we do have a question. If you have an aged and or immunocompromised horse in the herd, dry lot, stalled situation, should they be dewormed more regularly, even if they present with low fecal count?
So that's a good question. And like I said, the aged horse is becoming a more of a, I don't want to say issue, because it's not a bad thing. It's great that our horses are living longer, but we're realizing we need to know more about how to care for them properly. And so there's some thought that horses that, again, are getting past 20, 25 years, they might have, lowered immune response and potentially have higher shedding counts. If your horses still have, if they were a low shedder through their younger years and they're still at a low shedding level and physically there's no problems, I would continue to treat them at that rate. Talk with your veterinarian. That's probably where you'd want to stick with it. If you're seeing some health issues, you're talking with your veterinarian, or if you're doing the fecal egg count yearly and it's slowly rising, then you might need to reassess. Maybe we need to be deworming more regularly. So yeah, if they're healthy and the egg count is still where it is at and your vet's not concerned, I'd say you're good where you're at. But if things are changing, that's where you might need to reassess your management plan.
Okay, so way back when we just started, somebody had talked about horrible summer sores all over, or all summer and beyond, and has to be put on steroids. Wants to know if you are familiar with anything to stop this. And, they were potentially considering euthanasia because the horse was making, so destructive.
Yeah, that's a tough situation. I don't know as much about summer sores. That it sounds like, again, if you've been working your vet and trying the steroids, that's a good strategy. The quality of life becomes a concern, right? So I'd say that would be that discussion with your veterinarian and looking at assessing your horse's behavior. There's certainly a number of welfare scales out there you can look at with horse behavior to see how well they're doing. But I don't have a lot of good advice for the summer sores, unfortunately.
Okay, and so you have a couple of questions related to fly bites and bot remover, and one question asking if that bot-ridden stomach was the cause or just the cause of death in that horse, or just incidental finding. So,
Yeah.
And also, can I use a bot remover? And yes.
Yes. So the stomach, the picture of that bot-ridden stomach, I did not personally take, so I don't know the situation of that horse. Again, anecdotally from talking to veterinarians and the research and literature I've read, typically that bots are not the reason that the horse has died, because they're not, again, they don't seem to do any damage worse than what they might get through stomach ulcers, which that can be caused by a variety of things. Again, the times I have seen bots in a stomach, the horse, again, was put down for other reasons. So I would speculate probably not, because it's just not in the literature that they've had that situation. Again, compared to like the tapeworms or strongyles that are causing colic, which is a problem. You mentioned flies. So flies, oof, that's a whole nother lecture. I will say, again, Penn State Extension, we do have at least one publication, and I believe we have a webinar, if I recall correctly, on fly control, because I've got a colleague here who does a lot of fly control management. So it depends on whether you're dealing with filth flies or biting flies. There's some are territorial, some are based on a variety of other factors. There are management strategies out there, just like parasites. Unfortunately, you'll never remove all the flies though. So, but there are ways to reduce them. But again, if you go to search Penn State Extension Equine, we've got a whole bunch of articles and other recorded webinars. And I'm pretty sure we had a webinar for flies. We definitely have an article out there for fly control on farms, and then main flies you'll find out there.
There's one there.
I
don't know if that was the one.
Yep, that's the article. Again, there might be a webinar. I don't remember. Again, our colleague, she does flies and mosquitoes and ticks, and I get mixed up which talk she's given for us and not. So
ask and ye shall receive.
There you go.
So yeah, you bet. This has been great. So there's a couple. So is it possible and safe to never deworm a horse if they present a low fecal count every year?
Yeah, again, the general consensus right now is at least once a year we should be doing for even the low shedders. Again, that would be a conversation with your veterinarian, but they're suggesting still at least once a year to do mainly for adult horse, you're looking at strongyles probably. If you happen to have tapeworms in the area, that'd be something to consider, but yeah.
And we also had a question about rotating pastures. Of course, a lot of our pastures are sand with some small amount of plant life, but are there any pesticides you can use to assist with keeping parasites or worm populations down in the pastures?
Not that I'm aware of. That's not generally a practice that's also encouraged. Again, these parasites, they're just so gosh darn hard to kill. And so they can survive quite a lot of rigmarole. I mean, they can survive for years in the soil. So I don't suggest the pesticide route because you're never going to get rid of them completely. I don't know of products that are used for that. I have not been recommended that as a management strategy.
Okay. And
thought though.
Yeah, of course, we definitely don't want to just try and we don't want to add pesticides and such whenever we don't need to. But somebody asked, and I think it was just maybe they weren't quite clear. If your horse has a high fecal egg count, does that mean they are high shedders?
Yes, exactly. So yeah, when we look at the unit being eggs per gram, so a high shedder has a high fecal egg count. We consider it above 500 eggs per gram. So that would be considered a high shedder. And I've seen some horses like in the thousands, which is, they've not been dewormed in a long time. So it can get quite high actually for some of them.
Okay, so then, of course, what's the best pace? That we've got a couple times. And of course, that depends on what comes up in the fecal, correct?
Yeah, and again, I don't endorse or condone any specific products as a university employee. I say focus on the drug class. So the small print that they deliberately make small in hopes you don't read it. Read that small print. Do your fecal egg count to see what species. Again, that fecal egg count is good for determining mainly your strongyles, your tapeworms, and the ascarids. Again, for most adult horses, we're looking at strongyles being the problem. So those macrocyclic lactones are still seeming most effective for the strongyles in specifics.
And I would guess this one about deworming dogs on the same schedule. You need
I cannot speak to dogs. I'm gonna go. I have no idea.
Well, they do fecals on your dogs if you take them in for wellness checks or whatever all the time anyway. So you would do that based on that too.
Yeah,
so
I don't currently own a dog, so I only have cats.
So, well, this has been fantastic. I think we got all the open questions. I don't see.
Certainly my email address is on there. You're certainly welcome to email me for follow-up. I'm happy to talk more. Again, I know I felt like I crammed a lot of information in, but there's so much to say about parasites. So.
Yeah, and whoever had typed something about bots not being in Arizona, I was just looking around, and there was a resource where they said, in fact, yes, the male botflies are frequent hilltoppers. They fly in established territories at the summits of small mountains and hills in the Arizona desert. Does that sound like a so we may not have as many or as broad a problem as more moist places and such, but we do have botflies. And of course, in Arizona, you have snow up in Flagstaff while we're having beautiful weather down here. So it may actually even be within areas of the state as well.
Yeah.
All right. Well, thank you so much, everybody, for attending. Danielle, Dr. Smarsh, I thank you so much for joining us tonight. It's a little bit later in your land.
Yeah. No worries.
You're young. You can stay up late.
Yeah. Exactly.
So, we have one more. A few vets in my area are saying to deworm with half the recommended dose and give the other half 2 days later in order to prevent colic due to worm die-off. Is that an appropriate way to deworm?
So I will say I have not seen the AAP recommend that in their official recommendations. Again, I am not a veterinarian. I only have a PhD. So that is a discussion with
you. Just did research, not surgery.
Right. So I hesitate to give an answer on that because I'm not, again, the AAP guidelines are kind of what we have followed, and that's not out there. It's not I understand their reasoning why, since we talked about that issue with the small strongyles, but
I guess I would probably suggest that if your veterinarian is doing that or suggesting that, it might be a situation where they know there is a high population of worms, parasites, especially a young horse with roundworms, or ascarids, and so they're trying to prevent a blockage or something. But I would only, that would be a veterinarian question, but I certainly think that if they did that, it would be because of a known high infestation so that they can try and decrease the quantity coming out. You think about little puppies that have giant bellies with roundworms. Sometimes I've seen vets do that with them so that they don't have a big blockage. So possible parallel universe.
Yeah, I agree. Yeah, I leave that to the vets for that discussion.
And what is recommended to use topically for ticks? Will moxidectin work for them?
So we also have a tick web article on our website and a tick recorded webinar. I don't remember off the top of my head. I believe, pyrethrin comes up for ticks. There's a couple that they recommend. I don't think moxidectin, but there are some products out there. The key with those topical treatments is, to use a rag or something, not just to spray them on, and they don't usually last terribly long. So that's kind of a short-term remedy for like a trail ride or something. But the Penn State website, we do have an article and a webinar about ticks as well and tick management. So I would refer you to that.
Oh, hang on, we'll get you there.
Betsy is my looking up all these links for me.
Yeah, well, Penn State has a whole lot more horse people and animal people. There you go. There's at least one of the links.
Yes.
And we do here at U of A these days. So they have a lot of excellent resources. And we always look to share resources among our national colleagues. So we're happy to send you to information that's already there.
Yes.
And also
What's mine is yours.
and also work with your local veterinarian as well.
Yep.
So, all right. Well, it's 13 past the hour, so we are beyond, but I think we've had some great questions and great discussion here. So we are going to, we have to stay on just a little bit. So we're going to end this webinar, and we thank you for joining us. And our next webinar is next on the 11th. And let me just real quick before I do that. Here we go. AZ Ag at Home. This is youth and adult. Control copy. Here's the page that has the webinars, but it is on horses. And we actually have Dr. Krishona Martinson, who just drove into Buckeye. So she's actually in Arizona instead of Minnesota. And she'll be talking about hay. So there you go. There's your answer. February 11th, Josephine. So this one, anyone is welcome. Same time, different day, Thursday, next Thursday, not tomorrow, at 6 p.m. So again, thank you so much for attending. And we will go ahead and close this down. And once you guys are off, we'll finish our details and go from there. So thanks for joining us.
Thanks, everyone.
Good night.